Hi everyone, my name is Sriteja and today I'm here with Dr. Sarah Long. Dr. Long, thank you so much for being on here to talk. And if you want to introduce yourself to the viewers.
Thank you. Hi, I'm Sarah. Officially Dr. Long, but pretty casual, originally from the Bay Area. And I don't want to get too far ahead in the questions, but I guess I realized recently, I sort of always wanted to be a physician. And so anyway, I'm glad to talk to everybody and hopefully share some useful information just from my experience.
Thank you. Thanks goes to you. But if you want to tell the viewers like what type of doctor you are and what exactly you do.
Yes, so I am currently still in training, but working on finishing my fellowship, so I chose radiology. So it's actually a field that the public doesn't really know a lot about, and actually a lot of other physicians don't know necessarily a lot about how we work because we're a little bit different. We're a little bit behind the scenes, and it's specifically diagnostic radiology. There's also interventional radiology, which uses imaging to guide image-guided procedures, and that really has revolutionized medicine in a lot of ways, and so that's a really exciting field, but I'm specifically for diagnostic radiology, so that's helping come up with what specifically is the diagnosis of what's going on with the patient, using all different imaging modalities to be able to do that, and then working with the other teams in the hospital to help them out and support them to be able to figure that out.
Wow, that's really interesting. And for the viewers that don't know, can you explain what radiology is in like a few sentences?
For sure. So we look at x-rays, which, kids, everybody knows what x-rays are. They were basically the first modality to come about. 1895 was the first x-ray that was done. Dr. Röntgen, he actually radiographed his wife's hand, and that was the first one. And then from there, we have ultrasound, we have CT, which is, people know as CAT scan. That's basically using x-ray, but 3D, and then MRI, as well as other imaging modalities, including nuclear medicine. And so we really use all the tools available to us to be able to figure out the best way to know what's going on with the patient.
Wow, that's super interesting. That's like another side of medicine that people don't really think about.
For sure. Yeah, and like I said, we are behind the scenes. We don't spend as much time with the patients, but we're kind of there, like I said, to support the other physicians. And hopefully we get information that's going to help them out to know what to do next.
Nice, yeah. So Dr. Long, why did you choose medicine as your career path, and is there any story behind it that you want to share?
Yeah, so I wasn't actually somebody who had one specific event and then decided to do it. I was interested before going into college and, kind of had it on my list. I was kind of keeping my eyes open, but had different experiences, like different internships and spending time in the hospital, and all of those experiences, like I was volunteering at San Francisco General, the emergency department, things like that, kind of all reinforced it, and I felt comfortable in the environment, and I thought a lot about it, and just all the different aspects of it, kind of combining, just working with people, but then also the intellectual side of the human body, and kind of we call it the art of medicine, and it just seemed like a good fit. But then recently I was going through some old documents, and I guess when I was a kid, I told some physician of mine that I actually thought maybe I would be a doctor, so I guess it's kind of been inherent throughout. But I think it's one of those things that also, you kind of need to almost want the responsibility, because it is a lot of responsibility. Yeah. So I guess that was kind of inherent. I was always raised to just do something positive for the world, and so that also kind of fit in with that, and it just kind of evolved. But I did not go to med school directly from undergrad. I actually took some time. I worked with this really brilliant surgeon, and I was helping him out with a lot of really exciting projects. He's out at Dartmouth now, but that just blew the world open in terms of public health and other things, and there are just a million directions that you can take it. So just eventually decided to go for it, and here I am. But I think radiology was a good choice.
Yeah, that's a super cool story. Dr. Long, why did you choose radiology as your path? Like, what made you, out of all the other fields of medicine, why did you choose this one?
Yeah, so it's interesting. So a lot of people will talk about different personalities and different medical professions in different fields, and some of it is what draws you to it intellectually, and some of it is just what the right fit is for your personality. Is kind of interesting because for me, I actually chose pediatric radiology specifically very early on, and that's not very common. And what happened was before, so your third year of med school, you start doing your clinical rotations. And my very first clinical rotation, I went out to New Orleans for my medical training. So I was there for med school, and then I ended up staying there for residency. And my first rotation on surgery was at the Children's Hospital there.
Oh.
That was my very first rotation in my third year. And I noticed that the surgeons would always go by the reading room and talk to the radiologists about what was going on. And I just really liked that. And I really liked the collegiality of it. And I just liked that kind of team aspect of it. But then the fact that, the radiologists were kind of focused on, just specifically the imaging, specifically trying to figure out what was going on, but then corresponding with surgeons and other physicians to try to help them out. And then my next rotation, I think I had neurology rotation soon after that, and imaging also is very important for neurology. And so I just found myself like wanting to gravitate towards the imaging constantly. So whenever I was on the rotation, I just wanted to let's go check out the imaging, like that aspect of it. And so I think that kind of just solidified it all. And then it turned out to be really, my early interest in pediatrics has actually just maintained all the way through. So I'll specifically be focused on pediatric radiology, which is very different. A lot of the adult specialties or other types of specialties, a lot of the surgical specialties, radiology, they do training like orthopedic surgeons. Everybody will do training that you do adult through your normal training path, but then at the end you can subspecialize after that, which is what I've chosen to do. And I have no interest in looking back to adults after that. So.
It's really cool that you gravitated to child radiology at like an early stage. So that's really interesting.
Yeah, I mean, I feel honestly fortunate that path became clear. But it really is a different, people say like kids are not little adults, and that's true. I think that, so I was just working on a project today. We do fetal imaging too.
Oh.
So it's literally all the way up to, earliest scans, maybe like 20 weeks gestational age, all the way to adulthood. And then a lot of the problems that kids have, like a lot of the congenital issues, congenital heart defects, very complex, that kind of gets kind of funneled in as part of it too, because a lot of it's part of the pediatric pathology. And so the adult physicians, they have their own kind of gamut of things to focus on. But it's very interesting that a lot of kids that in the past would have never survived with very, very complex heart defects, which is something I've been learning about recently, now are living longer and longer just with the advances of medicine and the advances of surgery and very skilled surgeons. And now they're becoming adults that are living longer and longer. And so now it's really like they're going to be transitioning to adult care eventually, but still initially pediatric problems. So we really do see kids from literally 20 weeks rather in the womb all the way, into their 20s, depending on the issues. Yeah, and it really is. I mean, there's a reason that pediatrics is its own specialty, because it is completely different pathologies than, people who are 70 getting certain types of cancer. So.
Yeah, So that's something I have never really thought about. Yeah. So Dr. Long, can you take me through like a day in the life of you as and like what you do as a radiologist like in fellowship? So do you want to just tell the viewers like what you do every day and what it takes to become what you are?
Yeah, so I mean, so actually, as a radiologist, which this is one thing that I appreciate about the pathway of training in medicine, about like being a physician, and I think I completely support everybody deciding which path is right for them, like as part of the team, because there are shorter paths in terms of like being a nurse practitioner and different things. But I think the thing about like going through the entire training of being an MD is that you learn every layer, and that's why it takes so long. You go through, starting in undergrad and your pre-med courses, you go through every single, the biology, the physics, the chemistry, everything. And then within radiology, at the end of the day, we're responsible for the images. So even though we have technologists who are specially trained to take the images for us, and then we interpret them, we're still responsible at the end of the day for making sure that we have what we need to get the answer to the other physician who's ordering that study. So we actually study physics too. So we need to understand the physics behind every single modality of what we do, how it works, how to make it better, if there's problems, how to fix it. And specifically this year, actually, the reason I'm here with you all is because I chose to go to Stanford to work with the pediatric radiologists there, because they are just incredible in terms of MRI and just really perfecting every aspect of MRI. And so it's a lot to learn, but working on really fully understanding that. So to get back to your original question about what I do, I think one of our responsibilities is any studies that come in to just interpret those studies, and we have ways of dividing those work lists. But so there'll be a specific person, a specific radiologist that reads all the ultrasounds that day, or a specific radiologist that reads like all the CTs for that day, or different hospitals divide it different ways. But basically we look at all the images. I think it's best when we understand the bigger clinical picture, which is always something that I felt like it's important to take time to do. But we basically, the studies come in, we have all the images, and then we generate a report. We look at everything, we generate a report based off of those images. And I guess maybe the most analogous other field, which is also quite different, would be pathology, right? Because when somebody gets a biopsy, they have to process the slides, and then they look at the images of the slides, and then they make a diagnosis from there. And so again, we're part of the picture, and so we kind of look at all the imaging that's been done, that's there for us, but then we also do a lot of troubleshooting throughout the day. So we'll have other teams, like I love it when other teams come by and talk to us, and they'll say, okay, this is what's going on, which imaging do you think we should get? Because these are like thousands of dollars for scans. So I think it's best when they're ordered appropriately, and we're there to help them. And like I said, other medical professionals, there's so much to learn in medicine, and that's why there are all these specialties. They don't always understand all the complexity of what we do. And so we try to optimize, what to order to get them the answer they need. And then especially in pediatrics, we really focus on radiation and reducing, it's called, it's as low as reasonably acceptable, but basically to not use radiation if we don't have to get our answer, if that makes sense.
Yeah, definitely, yeah.
But so I guess that just day to day, it's kind of a mix of just reading the studies that come in, helping the technologists out if they have questions, and then also talking to the other teams whenever they have questions or different things. And then also, at an institution, like a lot of these, I was actually in Seattle last year at Seattle Children's, and also at Stanford at Lucille Packard, we have conferences with other physicians, so discuss the most interesting cases that they need help with, and so we'll also do that.
Wow, yeah. It's it's definitely a behind the scenes role, but it's like super impactful role as well. So that's also like super yeah, that's also like super cool. So Dr. Long, what do you consider the most satisfying part of your job? Like you just took me through like what you do in a day, but what's the most satisfying part?
I think honestly what I appreciate, I mean, it's very satisfying when you kind of just nail a diagnosis and you really provide an answer that somebody's looking for, and you say, okay, I can help you. I know what it is. And we have this term called Aunt Minnie in terms of patterns, like certain imaging appearances, we just know what it is based on the imaging. And that's always satisfying, and that's part of our training. But also just, for me at least, working with other clinicians and helping them solve the problem from the whole clinical picture.
So, Dr. Long, is there any one piece of advice that you would give to, like, let's say a high schooler like me with an interest in medicine, or someone who wants to go into like radiology or even child radiology? Like, is there any piece of advice that you would give to them?
Yeah, so I would say just put yourself in the environment. Just really have some self-reflection as best you can about, what aspects of a job are important to you, or what you like about a job, or what you don't like about a job. That's probably, or about an environment. Like that's probably the first step, is knowing yourself and what's important to you, because it is a lot of work. It's a very large commitment. And like I was saying earlier about responsibility, we hope we're doing something helpful and valuable, but it can be very demanding. And so I think like first, kind of recognizing like what level of responsibility you want to take on, but then also, just other aspects like just what fits your personality basically, because there are a lot of options, but also just letting yourself explore and letting yourself do different things. And I think there are some programs that if you know for sure you want to be a physician, there are ways to make it easier with that process. Like there are some programs where you can just apply directly, and then it's combined undergrad and med school, and that prevents you from having to do the whole med school application thing, which can be a little bit of a pain. But I think it's just really putting yourself in different environments, having more experiences, and then also think when you do have them, like try to reflect on them as you're going through them. Yeah. And because I really believe that it's such a tough field that you have to have an interest in it, almost like an inherent interest in it beyond, it can't be external, it has to be internal. It can't be because you want to make money. Trust me, there are a lot of easier ways to make money. Trust me. It can't be because somebody else wants you to do it. It has to be because you really want to do it. And it's a very big commitment. And so I think it's important to, and I mean, I know it's hard at, at your stage to like fully understand that, but I also just think take your time. Like if you don't feel ready to make a commitment, even for me, like I haven't made a decision about my next commitment in terms of a faculty position, because I know for myself that I need to take a little bit of time, and I can thankfully have some opportunities to kind of do some more like short-term work and things like that. But I think, at least in my experience in life, it's really cliche to say, well, listen to your heart and all this stuff, but at least for me, I've found that to be the case. And if you're not ready to make a decision, you can just be honest about that, and you can say, I'm not ready to make a decision yet, and because what I think is more difficult is to make one decision, not be sure, and then change it, and then change it, and that can be tougher than just trying to be a little bit more thoughtful about it from the beginning. But I will say also at this stage where y'all are at, and that's my New Orleans vernacular coming out, but it's really exciting. I know, everybody has their own stresses at their different stages, but it's exciting because you don't, I mean, thankfully in the US, in Europe and many other places, they have to make a decision very early on. But here, we're so fortunate to be able to have a little bit more freedom and a little bit more flexibility. And so you can just explore, you can sort of like have a path or like have a rough outline, which is kind of how I've kind of lived my life, is just, okay, this is a sketch and we'll kind of see if I need to erase a little bit of it, I could do that or modify. I'm not going to write it all down in pen or Sharpie immediately or anything. But, if you're gravitating towards something, well, obviously you are towards medicine, then, just explore it and then, just see what you think about it. But also give yourself the opportunity to maybe like dabble in different things, and then you'll compare. And then in terms of the specialty, I mean, that's so far down the road, to be honest with you. And I think a lot of people will tell people, when they do their rotations in third year, to have an open mind and to, just see what seems like a good fit. So there's no need to specifically choose a specialty up front whatsoever. I mean, I think it can be great if you just want to explore and you want to maybe help out with some research or different things, but it's more for just you seeing what is interesting to you.
Yeah.
There's no rush.
Yeah. Thank you so much for that great piece of advice. Yeah. And I also like, that circles back to like my final question, like, because AI is such a prevalent and emerging field nowadays, how do you see that dynamic with AI in your field? And do you think, a lot of people are talking about AI can replace these many jobs, these many fields. Do you think AI has the potential to do that in your field, or can you just like explain that dynamic a little bit?
Yeah, super hot topic, and I'm glad you brought it up because it is important. And I was listening to, a podcast, basically the conclusion of it, with some of the recent dynamics in Silicon Valley, and what's that guy's name? Sam, whatever, I don't know. But anyway, I don't even remember all the names of these companies, but I think the bottom line is that AI is out of the box. AI is coming, no matter what. Like it's coming. And so I think that there's been a lot written about, in radiology, if AI is going to take over, if that's going to be a threat. But to be honest with you, I'm not worried about it. I think actually I'm hopeful that it will be helpful. So just to give you a couple of examples. So one of the studies we'll do is a radiograph, and there's data about bone ages. So we look at the development of the hand over time, and sometimes there can be growth delays. And so we use these radiographs of the hands to help us figure out about just one piece of the puzzle about growth. And so somebody came up with an AI tool to help us with coming up with those bone ages. And until I came here, it wasn't really part of the practice, but I've noticed that they do a really good job. And it helps us because we actually are a very limited resource. There's a lot of reasons for that. But anything that can help us be more efficient is better for everyone. And so I'm hopeful, and I do believe that that's probably where it's going. So for example, another example, my boss Shreyas, he was involved with the company that they identify pulmonary nodules, and so it's AI that's doing it. And so a lot of times we'll have a patient, like an adolescent, one of the tumors they can have very bad bone tumors. There's one called osteosarcoma, and then one of the common sites of metastasis is to the lungs. So it's very important for the management to know if that's happening or not. And it can be sort of one of these tasks that you want to be very careful about, but it's a lot of cataloging, and basically this AI tool helps identify them, and it helps us out, and it makes us more efficient, so we can focus on the other hundreds of patients. And so So I think, those are a couple of examples of the tools that are already available that I already see being helpful. And I'm just hoping that more tools will be generated, and I believe they will. I mean, I know there are already efforts at Stanford and UCSF to be doing that will help make us more efficient. And I understand when, there's change and the new technologies that there's always fear about this and that. But I think at the end of the day, between the FDA and between all the complexity that goes into, doing our job, which involves communicating and helping other physicians who trust us, I think that'll be very, very difficult for a machine to do. I understand that the machine is probably way smarter than me and can remember a lot more and compute faster, but to model, I to be honest with you, I don't know a lot about AI. So I'm not an AI expert. I can't fully say, but I will tell you that at this point, and it's not just at Stanford, it's at other institutions where the physicians, there's already a radiology report that's generated at another institution, and they still want our input. They still want us to look at it. They still want us to check. So I think the consultation component of it will be very difficult for a computer to replace that. And I'm just hoping that AI will help us just be more efficient so we can help everybody more,
Yeah, that makes a lot of sense. Yeah, like instead of viewing AI as a threat, you view it as a tool that can help you further to make diagnoses and all that type of stuff. So that's really interesting to note. And
that's truly how I feel about it. And it's easy in radiology, I guess. I mean, it has a lot of applicability there, but that is actually really how I feel about it. Because I think there's also a fear, right, about like we don't want machines taking over fully.
Yeah.
Right. And I don't know once the cat's out of the bag what's going to happen or how you control that. And I think a lot of people who are way more experienced than me and are way smarter than me can maybe have different ideas about that. But I think it is important to be aware of for sure. And I'm hopeful that mostly it will be helpful, and I think that people do need to, or society and the regulators need to help regulate that, and so it doesn't become the machines taking over the world fully, and so yeah.
Well, on that note, thank you so much, Dr. Long, for this wonderful interview. I learned a lot, and it's like such an eye-opener to me about like the field of radiology and like the implications it has on society, and also like with AI coming in and like maybe changing the dynamic. You gave a lot of insight into this field and in medicine in general, and you also gave me a lot of advice too. So thank you so much for coming on.
Cool. Well, I have some questions for you, which is I mean, what's been two questions really. What is, in interviewing all these different specialties, how has your view changed in medicine? And then also, or I can do one question at a time, but.
Okay.
But I was just gonna say, kind of what's your sort of gravitation towards medicine also?
For the first question, like one thing that I learned among like learning all these specialties is I asked the same question, like does AI like harm or help your field? And every single one said it's like people say that AI is going to come and like take over jobs, but that is definitely not the case. But in fact, it will act rather as a tool to help further like make the whole medicine experience better and more effective and accurate. Because like in theory, you can never ever replace a doctor with human. Like it's like humanly impossible. So you can never remove the human, but if you add things to the human, that'll make the cure or diagnosis more helpful. So I think that's something I've learned, and that's also I've been thinking about it. Like after like 4 years of undergraduate and then like a whole lot of years after to become a doctor, like how will technology change things, and how it's like it'll definitely be different from today. So I guess that's like something I learned. And another thing is maybe that if you want to be a doctor, you truly have to be passionate about it. And I think that's also another thing. And to answer your second question, what do I like, what do I lean with in terms of specialties? I don't really know yet, but I think for the most part, like internal medicine, the doctor who I interviewed, that was really like interesting to me, like as a field perspective, and also because my mom's an internal medicine doctor, so she tells me a lot about it.
For sure.
But it's like the fact that like a patient comes in and you have to kind of figure out what's the issue with them, and then call for these like medicines and stuff. So I think that's really interesting.
Cool. Yeah, that's awesome.
Yeah.
Also, can I ask you one of your own questions about what else you think you might do if you don't do medicine?
If I don't do medicine, well, I have like experience in like 3 major fields. Like I really like biology and chemistry. Like people said like, oh, you're gonna take like a super hard chemistry course. Like you need to start like digging your grave already. But when I like entered that course with that mindset, like it's not really gonna help you. But I kind of looked at it like first like because I liked chemistry, but then a bunch of like backlash about that course. So it was kind of like neutral for me. But when I entered the class, I actually really ended up liking it a lot. And that's the same for biology too that I'm taking this year. So that's one of my interests. The second part of my interest is computer science. Like I've been doing a lot of, like I've been having experience in computer science and like artificial intelligence, like in the past recent years. And like just now I've been working on like building a neural network for one of my school projects. So
That's awesome.
Yeah. And then another field that I find really interesting is like business and entrepreneurship. Like I've just started this year with like a project that I'm doing. So all of these fields kind of I have interest in, but I don't really know what I'm gonna do yet. So I'm trying to make up my mind now.
Well, I will say that medicine is, I mean, we're, right, like medicine's about the human body. We're all humans. And all of those areas in some way or another interact with medicine. Mm-hmm. So it's pretty exciting in terms of opportunities and possibilities, and I'm excited for you.
Yeah, thank you so much. If you guys learned anything during this video, which I have learned so much, comment down below and be sure to like, comment, and subscribe. And see you guys next time. Bye.
Go Niners!